Intestinal lymphangiectasia involves the widening of lacteals, lymphatic obstruction, and lymphangitis, varying in severity throughout the small intestine. Certain dog breeds show a genetic predisposition to intestinal lymphangiectasia, although it can also arise secondarily from conditions disrupting lymph flow, like chronic inflammatory enteropathy or neoplasia. Intestinal lymphangiectasia is a common finding in dogs with protein-losing enteropathy. The presence of intestinal lymphangiectasia alongside decreased levels of serum albumin, cholesterol, and 25-hydroxyvitamin D may indicate a worsened prognosis. Despite its identification as a cause of protein-losing enteropathy over half a century ago, intestinal lymphangiectasia remains somewhat of a mystery, lacking a definitive consensus on optimal treatment. Sadly, nearly half of dogs with protein-losing enteropathy succumb to the disease. Traditional treatments include diet adjustments, glucocorticoids at varying doses, immunosuppressants, and supportive therapies, regardless of the precise cause. Octreotide, a long-acting somatostatin analog, has shown promise by decreasing intestinal fat absorption, inhibiting gastrointestinal vasoactive peptides, and stimulating the autonomic nervous system, proving beneficial in some instances of primary intestinal lymphangiectasia in humans. Though octreotide's use has been documented in treating chylothorax, insulinoma, and gastrinoma in animals, its application for intestinal lymphangiectasia or protein-losing enteropathy in dogs remains largely unexplored. The study indicates that octreotide is often considered for dogs with protein-losing enteropathy and suspected or confirmed intestinal lymphangiectasia that haven't responded to traditional treatments. In a subset of dogs where octreotide was the only therapeutic change, half showed clinical improvements. The drug was generally well tolerated. Given that roughly half the dogs with protein-losing enteropathy don't survive despite standard treatments, there's a pressing need for new therapeutic strategies. Octreotide's potential lies in its ability to reduce intestinal fat absorption and modulate the lymphatic system.